Oh, last but not least, I won't keep you long. I know we've got sausages waiting for those people here. I thought this was going to be a great idea when I first said I'll do human factors. It is literally, this is very much geared towards the written exam, and I've kind of taken bits from the curriculum. I'm not here to teach human factors. I'm just going to highlight some of the points which I think might be pertinent in the exam, with just a bit of background as well, which probably would be quite familiar for a lot of you as well. So some visual aids. I'm a visual learner. There's a lot of sort of images, and I put a few helicopter pictures in there to make this a little bit softer. So curriculum, there's a few little sections, a few domains in the curriculum. One of them is around critical thinking. These are the bits that I've kind of circled, which I'm just going to quickly touch on, which is just the importance of critical thinking, the cognitive strategies, and some of the pitfalls. Again, focusing this talk just on the curriculum. Critical thinking, I just did a quick Google, what is critical thinking? I was looking for set definitions. Essentially, it's just being more analytical, if you want to put a word to it. It's higher order thinking, higher order skills, using these sort of words when you're approached with a dilemma or you're making a decision, which is something we do every day in our lives. So this is the theory which you may have seen. So this is the dual process theory, where they talk about system 1 thinking and system 2 thinking. This has come up in the exam before, and I think it's recently been in some of the fellowship exams as well. So obviously ACEM do enjoy this, but it does make sense, and it's essentially how we process our information. You've got the sort of intuitive system 1, which is the informal, very subjective, very context dependent as well. It's our kind of go-to thinking, if you want. And then you've got system 2, which is our rational kind of thinking, the objective. It's a bit more thought out, a bit more analytical, and context independent. It's where we really actually stop and think about, hold on, let's think about the big picture here. So what makes us use system 1 a lot more, because that is where we spend most of our time. It's the environment we work in. So I've put a few things there where there's a lot of decisions that need to be made. We get tired of making those decisions. We often have this diagnostic uncertainty. This can be applied to an ED, to a theatre, to a lot of hospital settings. If you take that over to the pre-hospital setting as well, we've got all those extra things as stressors, which really exceed those encounters potentially in the hospital. And so as a result, our processes and systems, they're different, and we really need to try and mitigate these risks. So the curriculum talks about ways of mitigating these risks, mitigating bias, different strategies that we have. So just a bit of background as well. Some of the pitfalls in critical thinking that we often fall into are taking those shortcuts. These heuristics, as they call them, are kind of that I've seen this before mentality. This pattern I recognize, I'm going to go down this route. And this is very much what we do in our type 1 quick thinking. And it's normal, it's human, it's an adaptive thing that we do, but it is, however, the area that's most prone to error. So this is where the curriculum talks about how do we get ourselves out of that. Another pitfall, similar to the heuristics, is bias. There's a list of real different biases that you can see up there. I've starred a couple which I think are quite relevant to work in the pre-hospital environment. Again, mostly happen in our type 1 thinking. There's the kind of, they split it into the literature when I was looking, it splits into cognitive biases and then affective biases as well. Both of which are known to compromise how we make decisions. I've put in red at the bottom there, they talk about innate as well, so the hardwired ones, but then there's the ones that we learn and they've established in the course of our training, our working, our experience. How do we mitigate these? So there's Pat Crosscarry has written a lot of literature on this. Everywhere I looked, it had stuff written by him. He's given a good smack talk on this as well. But ways he talks about is sort of being aware that biases exist, being aware of that system 1, system 2 thinking. This is where we talk about metacognition or reflection and mindfulness, which I'll touch on in a moment. There's also just being aware of the conditions and the factors around us which compromise our decision making. That's our psychological, our physical, our environment. And then there's, in terms of strategies to try and mitigate that bias, they talk about cognitive debiasing. That's the phrase. So that could be an education thing. We do training all the time. We do lots of repetitive drills of things, and it's basically trying to prevent those biases in the future. And then there's also that consciously applying that metacognitive step. We have a lot of stuff. We have used cognitive aids. I've put a couple there. We also have the team around us, so it's that whole team-based decision making. I've put those in red because I think they're quite key words, which might be buzzwords in the exam. Mindfulness and reflective practice. So they seem to make a big focus on that as well. So what is metacognition? Yeah, there's a definition up there. Essentially, it's achieving that balance between system 1 and system 2, monitoring what our unconscious brains are doing in system 1, just being aware of that, and then trying to decouple, trying to get yourself from that thinking to system 2. There's different techniques. There's Mike Lowry's sort of breathe, talk, see, focus, your positive self-talk, your tactical breathing. But essentially, it's just being vigilant to your way of thinking. And that takes training. It takes, you're not always it's not going to happen overnight. But this is what it means by metacognition. And reflective practice as well is another thing that we do, where we learn from, not mistakes, or learn from cases, that we've done in the past, and try and build on it. And that it's supposed to frame our kind of ability to bias or inability to bias. And then obviously I put these two up as well. There's lots of acronyms hanging around from the aviation side of stuff. There's the I'm safe when you're thinking about, am I fit to fly? And then there's obviously, we mentioned already, the 0-point survey. And I think that does encompass everything in terms of your kind of physical and psychological limitations, which I think are key for this exam as well when you're talking about critical thinking. And then I just put this, if you didn't take anything from the last few slides, it's very much some key words here. This is Stephen Hearn's in his kind of work with performing under pressure. So I created this little model. I think there's a lot of, I kind of liked it actually. It's kind of preparing for high pressures, for high stake events. You've got your predictable routine, what we know is going to happen. Then you've got your predictable emergency, what we know might happen. And then you've got your unpredictable emergency, what we need to kind of, that's the bit we need to preserve our cognitive and analytical capacity for. And there's all those things around the edges which help us to do that, like drilling your mental rehearsal, the positive self-talk, as well as cognitive aids. So I think that slide sums up what I've just mentioned earlier. Whilst I was preparing this, it's a bit of a mishmash, this presentation, because I thought there'd be other little softer parts of the curriculum which may not be touched on. So I just wanted to touch on them very briefly. So just moving on, there's a whole section in communication. I thought this bit was the conflict resolution and graded assertiveness. We covered this in our induction, which is fresher for me than maybe some others, but the different ways that we can kind of do conflict resolution. We talked about CUS, the I'm concerned, I'm uncomfortable, it's not feeling safe, and stop. So these are certain phrases, like an acronym, which I seem to remember, but it's good to have a kind of system in your head, I think, when you're talking about graded assertiveness and conflict resolution, as well as just making sure we're keeping this patient-centered. I think that's also a key word when it comes to the exam. There's a whole section on communication processes as well. So structured communication tools, how we do daily briefs, the role of a clinical handover. Again, this is what we do in our routine work, but just to put it into a more objective kind of picture for this presentation, certain acronyms which we would use, but it's probably good to have, the tip of your tongue. So you've got your IMIS for handover, which is used prehospitally a lot of places, your SBAR for your kind of handover as well. I put the observe acronym as well, which might be specific to here, I'm not sure, but just kind of a certain system to when you're in an aircraft, in an asset, and you're about to leave, and kind of making sure that, a way to communicate to your colleague as to kind of last minute check. But nevertheless, these are just structured communication tools, of which there are many, which I thought I'd mention. Daily briefing, I just thought we do it every day in our jobs. I mean, there is an actual system to it. There are certain things which need to be mentioned, so I've just put them up here, which I'll send you a copy later. But this was from the pre-hospital cases textbook as well. But I think generally there's slight variation, but it's essentially this when it comes to your daily briefing. helicopter picture just as a little break. And then this was touched on by our colleagues in the US earlier. So just the whole maintenance of your safety culture and your just culture. So just culture is a phrase which we've heard, which is important, I think, and it's good to know. But essentially, it's that blameless, non-punitive environment that we work in, a place where we can seek and reflect on our feedback. And I think the tangible examples that we would have would be our coffee and cases, our clinical governance and case reviews, mortality and morbidity meetings. Again, I think probably quite pertinent to have those examples for the exam. And then we talk about a safety briefing as well. So this is safety culture as well, which is essentially the way we do things around here, being able to speak up. And this is where we have our standard operating procedures, of which there are many, and we have our key performance indicators as well, which are auditable, such as our airway and blood audits and stuff. So again, just good to have those examples for the exam. And that was it. I told you it was quick, but just covering certain little bits. Any questions? Perfect. Thanks, team.
There's